Day 5 of the Seattle study tour visited the Veterans Affairs in Puget Sound Healthcare. The VA is well known throughout the United States. It has more than 150 centers, and we visited one of the largest here in Seattle today. Many insights from the VA. It is the healthcare system that's described as the closest thing to the NHS in terms of it being called socialized medicine. And so the values of many of the people that healthcare leaders met today sits well. The passion that they have for doing something for a group of people, the veterans, also drives the culture that you have and that's visible everywhere. We saw a great program of how the VA are extending what they do in primary care outreach, but also primary care in their outpatients clinics, which happen on the campus, where they've gone to interdisciplinary teams. These teams undertake education and training together, and today we managed on the visit to also see how that works in practice. So that means the doctors, the nurses, and both of those disciplines in training. You have social workers, psychiatrists, psychologists, and therapists all together in the same corridor, and they do daily huddles and think of the holistic needs of the veterans that they'll be seeing that day. Many artifacts and appreciation boards and letters and stars reinforcing the great work that new model, they call it PACS, is achieving in primary care, and that's certainly something the leaders on the tour want to take back to the UK. I think the fact that the VA have an IT infrastructure and their utilization of telehealth and the modernization of quite a lot of the IT that they use, vital signs and different programs, quite impressed the group who got a chance to look at that today. I think there's something about the way that the VA hold their doctors to account in terms of the way that their performance is evaluated. If you're new, it's after 90 days. Following that, there is a 6-month review, and that includes peer review. And if at any point it's found that the clinical outcomes are not similar to others or there's any difficulty, then retraining is offered, remediation is offered, but the evaluation is continuous. And that's something that people were taking back as one of the learnings from the VA. There's something about a strive for continuous improvement in the face of quite highly regulated and a top-down structure, very different to some of the other structures we saw this week. People at the VA are government employees, but nonetheless, one of the things we saw on site this week, today, was a home, a partnership between the VA and a third sector organization who have a home on site for people whose families need to be with them while they're receiving care here at the VA. And that's another, it was a home that looked like a hotel, every facility that you could want, 26 beds, served more than 4,600 families, in the number of years that's been opened. And there was just something very lovely about knowing that people could be near the veterans that were being looked after if they needed accommodation. There were some rules in terms of, you had to live 50 miles or more away to be eligible, but that's something else, collaboration between third sector and a secondary care provider that people would be taking back with them as learning.